So the health economics for this study is really looking on to follow on from the recommendation to say, well, what is the research we can do next? And there are some limitations which Kaya had touched upon, is that in order for us to model any of the health economic potential health economic implications of any of the proposed ideas, there needs to be a clear clinical evidence base on the effectiveness of the proposed idea on pregnancy outcomes. And because of that, then we were limited on what we could do. So the really only clear recommendation where there is a large body of evidence showing its effectiveness on improving pregnancy outcomes is free vitamin supplements, so specifically vitamin C, D, and folic acid. And so that is what we are focusing on in the health economic evaluation. Next slide, please. So currently, free vitamins are offered to all pregnant women in Scotland, which also makes it much easier to think about doing a future study, because that is a very useful comparison group. But in England, how do we know if we should roll this out or not, and if we need more research in the area? So that's the main question that we're addressing with the health economic analysis. And then in the next slide, I'll talk about how we're going to do this. So next slide, please. So what we're going to do is first, we're in the process currently of doing making a decision tree where we extrapolate the cost of providing free vitamins based upon the data we have from Scotland and the effectiveness of reducing negative pregnancy outcomes associated with vitamin deficiency. So that includes preterm birth, preeclampsia, low birth weight, and gestational diabetes. And we compare it to current standard practice, which is that some low-income women are eligible for free vitamins, but the uptake is incredibly low. And so we take the information from our decision tree to decide if there's any value to decision makers of future research study to evaluate universal receipt of free vitamins in pregnancy to reduce uncertainty around cost effectiveness. So this is called an expected value of sample information. We'll take the data from our decision tree and decide if it is worthwhile based upon, I guess, uncertainty around the estimates for a future trial, or if with the data we have, we would suggest just to roll it out without